Picture this. A patient stops breathing. The family is panicking. The room gets loud, it gets chaotic, and in that moment, every eye in the room turns to one person, the nurse who's there. That kind of pressure doesn't come from instinct. It comes from training to respond. And during Nurses Week, we are going inside what it takes to become that person. Jennifer, take us inside that moment, a time where everything a nurse is trained for becomes real.
So honestly, in that moment, one of the things we do is our brains shut down and we rely completely on the training. So we're relying on the muscle memory of what we have learned, the knowledge that has been ingrained in our heads, and we just move through those steps.
And that's the reality that most people never see. That's exactly why this conversation really matters. Welcome to Voices of Vital Care. We're glad that you're joining us today as we are joined by Jennifer Morelli. She is the Nursing Program Director at Pima Medical Institute in Tucson. Jennifer, thank you so much for joining us for this important conversation. And we want to say that we appreciate you,
thank you.
As we head into Nurses Appreciation Week.
Thank you. I'm glad to be here.
So before we get into the program, let's stay in that moment that you just talked me through. What is happening in a nurse's mind in a moment like that when the training is taking over?
So when the training is taking over, it comes down to communication. So a lot of times, nurses, we are the eyes and ears for the physicians. So in that moment, we are collecting data. We're looking at our assessments. We're trying to piece together trends of blood pressures, heart rates, really all the essential information, because we're going to have to relay what we are seeing appropriately to the physician.
What's the margin for error?
It's life and death.
I mean, that says it right there. What do people not understand, would you say, from your perspective, about the level of responsibility that nurses carry every day?
I think it falls into that life and death piece. I know a lot of people come into nursing because they want to help somebody. And I think really when you get into the clinical setting and you're seeing the outcomes that people are having, and you're realizing how one oversight could really be detrimental to a patient, it kind of adds the pressure, right? It adds the importance of why we need to be able to react and to know the content that we know.
So let's go there. Talk me through, how do you prepare someone to be able to handle that moment and not freeze when we are dealing with life and death?
So with our program at Pima Medical Institute, we have our didactic classes where we have to teach every concept under the sun. And so for students, that can be really challenging and overwhelming, but we take it piece by piece, and every semester we kind of add a layer. So we are constantly reviewing, for lack of a better phrase, the content every single semester. So everything is constantly in the forefront of their brain. The other piece to it is going to be more of like a lab and clinical, where we are practicing those skills. We're doing that muscle memory, because the goal is, at the end of the day, in that moment, right, they have to be able to react and know that they have the skills and the knowledge that they can move forward.
I know that everybody is an individual and different, but you've been doing it long enough that I'm sure you see patterns. So is there kind of a collective moment more often than not where you do see that it clicks for students that this is real?
100%. We usually see that in clinical initially. So, they'll take something as simple as, like, my favorite one is hand hygiene. I'm sure everybody thinks they know how to wash their hands, right? You get into nursing school, you very quickly learn you don't actually know how to wash your hands. So many people, I guarantee, don't stand there and actually spend, the appropriate time singing happy birthday twice to be sure that you're lathering. And even after you rinse your hands, even the drying and the process that a nurse has to dry their hands matters, to not recontaminate their hands. So in taking a moment like that, you get the students in the clinical setting, and you see them all of a sudden have this appreciation of infection control, right? And that's kind of where they start to have those moments of like, okay, this kind of makes sense. My instructors actually know what they're talking about. And it just kind of builds from there.
How do you get them to understand the weight of something that seems so trivial in most settings of washing hands without making that mistake and carrying it into a patient room?
So in our lab setting, we actually have Glow Germ, which is an oil base that they will put on their hands. So we have them actually put it on their hands. We send them to the bathroom to wash their hands. And, they should be doing it appropriately. Sure. Happy birthday twice. Then they come back in and we have a black light. And so we will take them into the room and they're actually able to see all the areas of their hands where they've missed. So then we talk to them about, what if that was MRSA or C. diff, things along those lines. And now you are, touching these patients, or you're, you think you're running into a patient's room and you don't put gloves on. There's a consequence to that, right? Mm-hmm. So really it's giving them the visual.
Is it during those lab trainings or during clinicals where the pressure really sets in and where they feel that pressure?
100%. My favorite semester is second, because that's when they first start their clinical rotations. And that is the first time where they're no longer practicing head-to-toe assessments on their friends in their cohort or on faculty. They're actually having to do it on a real patient. So taking a student and going into a patient's room and then having them have to talk to a patient, mm-hmm. that's very different than talking to your friend. And then B, doing the assessment skills and having to actually put your hands on a patient and listen to their heart and their lungs, their abdomen, all of those things, because it's not a friend, peer-to-peer situation. You can see the nerves kind of set in with the students of, okay, it's actually important what I'm walking away with, and am I getting the assessments that I need to? Am I hearing the right things? So that's my favorite time with the students.
Yeah. And, we've talked a lot about at Pima Medical Institute, we have accelerated career paths that you can be on. Mm-hmm. But that doesn't mean that these are easy programs. These are very intensive, workload heavy programs. Correct. Is there a time where you see students more often than not where they tend to hit a wall?
It is typically in that second semester, because in first semester, it's a lot of the prereqs. In second, they're really getting that foundation. So we're covering everything from asthma to COPD, hypertension, diabetes, all of it for the very first time. So it's a lot. And then they 100% will hit that wall. And, the key for when they hit that wall is truly to look at them and remind them of their why. So I think for most students, everybody has the why did I pick nursing, right? Mm-hmm. And with that, they really have to be able to cling on to it, right? So they have to be able to reflect, am I doing this, to, set an example for my kids, or am I doing this because I'm the first one going to college? Did I have an experience as a patient, or did my family member have an experience? And it's really holding on to that and reminding the students sometimes.
Do you see that light bulb moment when you bring that to them and let them know, because you see they're about ready on the brink of quitting?
100%. You have to. So we at PMI, we have an open door policy with my clinical director and I and faculty. So at any given moment, students can walk into my office, and they do. I have a crying corner where we have a beanbag chair and Kleenex and chocolate. But students will come in and, life is still hard. Life happens, even though they're in nursing school. It's an intense accelerated program. And I think we all have those moments where we feel like we're breaking, or maybe we don't have as much support, or life is just getting hard. And yeah, it's really reminding them of the why. And I ask them that on their interviews into the program. Mm-hmm. And we have those conversations quite frequently.
And I think that says a lot about the culture that you've created to have an open door policy, and the fact that they would feel comfortable enough to go into the program director's office mm-hmm. and cry on the beanbag chair and yep. have the chocolate. I think that really says a lot of the support that you're offering as well to push them through.
Yeah, PMI is very much family oriented. They are pro-student 100%, which is why I've chosen to work for them. And everybody in that building and then in that company, if a student needs them, guaranteed they will be there and they will take the time to listen. So, yeah.
So for someone watching right now, a student figuring out if maybe this is the right path for them, talk me through what the day-to-day looks like for students in your program.
So we do tell students it's a Monday through Friday, 8 to 5 commitment. And that's because that's when their classes are going to fall. So we are a 20-month accelerated program. The prereqs are built into it. So day to day, they're going to have classes, probably 3 to 4 days a week, where they are sitting in a chair. They're going to have lecture. One of those days, they will have hands-on practice in lab. And then starting in second semester and going through fifth, they'll have a 12-hour clinical day. But even with clinical, they will have an instructor with them. at patient bedside, which is nice. In 5th semester, we pair them with a nurse and they do a preceptorship. So they get to work their 144 hours alongside an actual nurse. They work the nurse's schedule. And so a lot of times that will lead to a job opportunity for the students.
I imagine that's also preparing them for real life schedules because while nurses can have a lot of flexibility in their careers, the hours themselves when you are on shift are very long.
Yes. And the students in a preceptorship, if the nurse is there for 14 hours, then our student is there for 14 hours. The expectation is the students are then the ones calling for, any kind of discharge paperwork that needs to be happening, or they're the ones calling lab, they're the ones calling the physician. So by the time they're in that role, they're well prepared to take lead on the patient care, and it's more of the nurse who's kind of overlooking their over their shoulder. So.
You're also training across many areas: labor and delivery, pediatrics, trauma, surgery. Why is it important to expose the students to all those different sectors?
So one of the great things with nursing is you have options. There's lots of doors, right? So with that, I will quite frequently have students come into the program. Their heart is set on one thing, but truly to not get burned out in this industry, you have to find the area that calls to you. Mm-hmm. So our goal is to expose you to as many as we possibly can. And you may do a pediatric rotation. That was me. I thought I wanted to do peds and did not. It was not my calling. I found my calling in a different area. So really, the more we can expose them to it, there's key things you can take away. A lot of it is how you approach a patient, right? You have to be able to deal with parents if you're taking care of a baby. You have to be able to communicate to a 3-year-old and talk to a 3-year-old about how we have to start an IV or they're going to have to get a shot. The technique for doing the shot's the same, but it's the therapeutic communication that changes. Even in the OR, you're going to have somebody scared going into surgery. So how do you comfort them? So it's a communication piece in why we expose them to that.
You also talked about the simulation labs, and I imagine that also has to do with exposure and kind of giving them more of that real world scenario. So talk to me more about what those labs do for the students before they ever step into a real clinical situation.
Yeah, so with our labs, we have a couple high fidelity mannequins. So they have heart sounds, lung sounds, abdominal sounds. Faculty, we can talk through them. They have pulses. We have one who gives birth. They can have seizures. So lots of different options and the types of sims we want to run. But with that, the goal is for students to make the mistakes in that setting. So I would rather challenge their critical thinking of a scenario in a lab setting with faculty navigating it, where maybe they make a mistake and we're going to drop the blood pressure. In real world, maybe that would, possibly like harm or kill your patient. While in a lab setting, I can make it super low to where you're stressed and panicked. You learn the lesson though of, the consequence for maybe not double checking your medication or doing an assessment. So it creates that safe space. I would rather the mistakes happen there in lab than obviously like with an actual patient.
Certainly it's allowed you to bring the education training probably a lot further and a lot more realistic.
Yes.
Before actually having those real world scenarios. Are there skills that you find that your students are really excited to learn more often than not when they first start out?
It would be doing injections and IVs.
Really?
The motivation to poke somebody is definitely strong, but that is also probably the thing about it that they are the most nervous about is they don't know how they're going to respond when they see blood. Because how many people actually like to go get a shot or get their blood drawn? Because I'm not one of them. But so for students, it's the excitement of like, I actually get to do it. But then they're like, I don't know, is it going to be okay if I see blood?
Yeah. So. And it also seems to be the one that they end up most proud of when they nail it and nail a PICC line and they nail the IV start or a blood draw that they didn't need a double.
Yep.
There we go. Okay. For the students who make it and the ones who don't, maybe the ones who have come into the cry corner, and that is where it has closed. What would you say is the defining factor that separates the two?
I think the big one, because everybody has their why, I think the big thing would be the support system that they have coming into the program. I know for myself and my team, we can be a support system while students are there, but at the end of the day, when they go home, they're relying on their partner, their spouse, their parents whatever that looks like for them. So when I have students who really want this, it's important that they know they need to have that support system in place. Because once again, life still happens. We have students, they get married, they get divorced, they're having babies, loved ones pass away. So, there's car accidents, everything under the sun still happens that would happen in your normal life. But now they're in a condensed, high stakes pressure cooker, really. And so they don't have necessarily the time to feel like all the other roles.
Yeah. And understanding also the separation, I imagine, has to be part of that, your support system, but then also your emotional separation, because you're in high pressure and also dealing with a lot of heavy topics and people in some really difficult moments. Sometimes their best moments enjoyed, depending on which realm you chose. What is the advice that you give them for finding that support and dealing with the emotional toll?
We have them lean into a calendar, honestly. So one of the things we tell people is to schedule your self-care time. We tell them to schedule your family time. I have a lot of students with young kids, and it's hard. Mom guilt, dad guilt, it's real. You're doing it to better yourself and to, help your family, but it's unfortunately like you're saying no to soccer games, or you're saying no to cheerleading practice and stuff like that. So really, the more you can create a schedule and a routine, it's kind of like being where your feet are, right? So if I'm at school, I need to be focused on school, which means if I can schedule my family time and my self-care time, I don't have to feel guilty about it, right? If I'm living in that moment of this is my self-care time or my family time because I know I've scheduled my study time and my classwork, well, now I can actually enjoy that downtime because I've allotted for it in my schedule.
Okay. And so when we're talking about, then that's part of that real life shift that happens in your home life. So if you're being where your feet are, as you say, I love that, and you're back on campus in class, and you're transitioning then from the labs to your clinicals, there is also a shift that happens with students. So what is that shift for them in that moment that brings it now into the real world?
I think for them, it's the confidence. So I will notice that in lab and in the classroom, they don't have as much confidence at times. They know they're a student. They're definitely in the student role when they're in their school scrubs and everything. But it's fun to see them when they go into clinical because now it is a different color of scrubs that they wear. They are working alongside a nurse. They have the real patients. And to see them really shine in that moment, that's where they're realizing, I actually do know some things. I can do some skills. My nurse is actually letting me go into this patient's room by myself. And so that's really where their confidence starts to grow and shine.
What are they learning about themselves in that confidence in that moment?
Honestly, that they know more than they think they do, because the content can be so overwhelming and it's lifelong learning. There's still a lot of things that I don't know. We tell our students all the time, to go find an adult the moment you feel like you don't know something, because my background is not labor and delivery. I know some things, but if you ask me other things, I'm going to defer you to my labor and delivery faculty member, right? Same thing for ICU. I would defer you to my ICU instructor. So it's okay. And we always want the students to know it's okay to not know everything, but then to speak up if you don't.
Where does that moment usually happen that they do start then thinking like a nurse and not a student?
Probably in their fourth semester, so we're 4 out of 5. But that's really because we start pushing them in the clinical setting to not just take one patient, but to now start taking 3.
Okay.
And so now we're building in the how am I going to prioritize care, right? If I have 3 patients, who should I be seeing first, second, third? How do I want my day to look? So they're taking more accountability and autonomy of the patient flow and their day. And that's really where we start to see these strides in the students.
What does professionalism look like out in the real world setting? And when they start taking on more patients, what does that really mean?
So when we look at professionalism, it's really, for me, it really comes down to communication, having integrity, and, being respectful. It can be hard as a nurse. You have to walk into a patient's room and instantly build a rapport. If you walk in and you're looking upset or distracted, the patient's going to shut down and not want to talk to you because you're not appearing like you care, right? So it's interesting for a nurse to kind of have to navigate that. Communication is key. We have to be able to communicate with physicians. We have to be able to communicate with, social workers, case managers, dietary, but then also to the patient. And sometimes that patient can be a 3-year-old. So the scope of communication is huge.
And you talked about balancing. Sometimes it's parents and they're scared. Sometimes it's someone in the OR and they are scared.
Correct.
What would you say is the mistake that new nurses, students make that get them in trouble if they don't have it?
I think the mistake that they most commonly make is, I think we forget sometimes in today's society how to talk to people. And so I think we very much are in a society that is just go, go, go. And sometimes it's okay to not have the answer. It's okay to just sit back and listen. Most of the time, patients just want to be heard. They don't need us to solve their problems. They're already there probably because they're having a bad day. And it comes down to they just want to be heard. And so I think a lot of times for students to learn that it's okay to just sit in the moment, just be present with the patient. You don't have to have the right answer, which I know when we're talking testing, I expect them to have the right answer. Sure. But that's okay in those moments with the patient to just sit there and hold a hand and be at the bedside and let the patient have their feelings. But that can also be uncomfortable for people to learn how to be comfortable in silence.
Well, and when you're coming out of school and you've been so busy doing the checklist, what did I learn, putting it into practice and remembering you're also a human there in that moment, and to take that breath, as you said, and be there. Because as you mentioned, you are sometimes dealing with people in their toughest moment on their hardest days. As a teacher then, and passing that knowledge on to your students, is there a moment for you that sits with you that you share with them to help bring that message home?
We do. So for me, once again, my heart lies in the second semester. It's in that moment where they're first learning how to talk to patients. And that's really where I like to live with them. And I go with them all the time to clinical. So does my clinical director, because it's in those moments where they're seeing it's the human piece. They're seeing patients with where they're at. They're nervous enough to know they may not 100% know what they're doing. So they're not rushing through things. They're still like this slow down kind of let me take a pause, because they're still very much checklist, checking the boxes in second semester. So it's a good opportunity for them to start to learn that there. And then unfortunately, they'll see things in clinical. They might have a code that they have to respond to. They may have a patient who's on comfort measures or we're withdrawing care. And I think to have our clinical instructors be able to walk through those moments with the student, to see family at bedside, crying, grieving, or maybe it's, a terminal diagnosis that a patient has just gotten. And now we have to, we're still going to give care to them, right? They're still there during our shift. And so to see the students kind of walk that out with our clinical instructors is key. And we do a lot of debriefing with students after clinical, depending on what they've seen, just to kind of help them navigate some of the feelings and emotions that might come up with it.
Do you have a hard moment that still sits with you?
Lots of them.
Yeah. They've shaped you, though. They've moved 100%. You forward each time.
Yep.
Translating that. And I would imagine as a student, it makes it more relatable as well to know, because sometimes that can feel like a very lonely moment as well, that you've seen, but to know that the people guiding you know exactly where you're standing, I would imagine has to make all the difference as well.
Yeah. We actually share those moments with our students. We try to very much humanize our own experience and share what we can. Because as faculty, we've had those patients that have touched our hearts. I've had patients where, they were out in the community, so not even in the hospital setting. I've had to do CPR on the side of the road. And it turns out it was actually, the person was connected to one of the students. And I found that out 6 months later. So there's definitely moments that stick with you. But transparency with the students, I think it helps them understand, that those moments are going to happen. It kind of helps them, I think, anticipate or see how we have grieved or how we've coped with it. Sometimes it's like us setting the example for it and knowing that it's okay. It's going to shape you. You can be sad. you can have the feelings. Because the one thing you don't want to do is suppress it, because then you kind of lose that human piece. And at the end of the day, you're going to have another 12-hour shift and you're going to go back in there, and you can't always carry the weight of like the last bad thing.
That's where I wanted to ask you next of how do you tell them to balance their skill with compassion, and also the other way around, balance the compassion with skill so that they don't get so sucked into a moment either that they forget their training?
Yeah. So the skills are easy. I can teach anybody how to start an IV. It's the compassion piece that's harder. So when we're doing the interview process for applicants, we're looking for that compassion. And people have different levels of it. The only way that we've ever really, I don't even think we can teach compassion, but we lead by example. So faculty, we show those human pieces of ourselves. We share the vulnerable stories, the sad moments, and really let the students see light into what we've gone through. So even my faculty who went through COVID at bedside, we very openly shared what that looked like with students. Because there's a whole grieving process that people all go through, and it's important to see that.
First responders and last responders, you're all wrapped into one.
Yeah.
Also, when we think about nurses in a setting, if you've ever been into a hospital or a care situation, we see nurses more than anyone else, really. And so you also can be a patient advocate as well. So what does patient advocacy look like in the field, and how do you translate that to your students?
So in the field, being a patient advocate is really, it starts with listening to your patients. It's making that initial connection with your patient, getting them to feel like it's a safe space to open up, listening to their concerns. Where it comes into nursing beyond that is now we have to not be afraid to speak up, right? We have to be able to communicate with the physicians if there's something we're seeing, or any of the other interdisciplinary teams. And with students, that can be really challenging because they're going to look to physicians or other members of the team as a more of authority role because they're seeing themselves as a student. That's where the confidence comes into play of like really building our students up so they realize that their voice actually matters. And I've told them numerous times, it doesn't matter if you're a student. If you're questioning something, speak up, right? And we've actually had students from time to time question lab work or come to a clinical instructor and be like, well, I don't know, I'm really confused about this. And we sit down and we talk about it. And then the students will go back to the nurse and then ask a question. And the nurse will then say, you know what, that's a really good catch. And they'll communicate it. So we've had students from time to time, catch things that maybe we need to draw an extra lab, or we need to, change something in the plan of care. So those are wins for students for sure.
I would imagine that's the moment where it's clicked for somebody, and you see the confidence, the skill set, and all of it really come into play and see it in action.
Yeah.
So now you've taught them the confidence, you've taught them the calm as well. How does this then start changing their life from what you've seen?
So obviously with the confidence and everything there, it's opening doors. So the great thing about nursing, and one of the reasons why I went into nursing, was there's job security in it. I can move to any state or anywhere that I want. I know I can provide for my family. I get to do what I love every single day. And so really taking those next steps and getting into nursing or really any healthcare field is just growing. The whole field is growing. There's a shortage of nurses, and so the demand is there. And really, if you get tired of being a med-surg nurse, you can move to the ER. If the ER is not really where you want to stay, you can do flight nursing, you can do ICU. So you don't have to restart over to go into a different area of nursing. You literally just have to say you want to switch, and then they will take you and they'll train you and switch you, which is great.
What paths within nursing would you say are out there that surprise people the most, that they didn't realize might be a path option for them?
You can do flight nursing. I think travel nursing is probably the biggest thing right now. The new students that I'm getting want to do, which is great because you can do contracts, right? So you can literally travel from place to place, work somewhere for 3 months, experience it, and then you can go somewhere else. The beauty industry, doing Botox and fillers, has really taken off. And so that's another area if you're into, that piece of it. it's available. You have weight loss management clinics where you can do nursing there as well. So it's such a wide variety.
What's flight nursing? You mentioned that.
Flight nursing. So I don't know if you've ever seen the helicopters that land on the hospitals, but basically they respond to car accidents and things like that are a little harder to get to. And you literally are managing the patient from the time you pick them up at the accident all the way to the hospital.
Wow. So we've talked about where you can go. We also discussed the who makes it, who doesn't. Is there a trait, a person, a personality who maybe shouldn't go down this path, that they're following it, they think they should, but maybe it's not really right for them? Is there anything that stands out?
I think if they have a why, they should be fine. I think if there's not a strong pull to it, it can be a very challenging and demanding, and at times, emotionally draining career. So I think you have to have the desire to want to help people. And if you have that, we can absolutely take you and turn you into a nurse. But usually you have to have that core trait. I've seen students come in and they want to do it for the paycheck. They're going to get burned out. So yeah, it really comes down to their level of compassion and empathy. And as long as they feel like they have some and they want to make a difference, we can work with that. And
if they are that person, what would you say to them right now? What's the next thing they do?
The next thing you have to do is just you make a phone call or you walk into the campus. There's a great team at PMI and they will absolutely walk you through the next steps and the entrance exams. And maybe it's not nursing, maybe it's PTA or OTA, radiology. There's so many. So even if nursing isn't it, I know for nurses, usually respiratory is not our thing. We don't like to do the suctioning of patients, but I also know if you ask a respiratory therapist, nursing is not what they would want to do. So there's usually some, defining key features there. But yeah, the admissions team will 100% walk them through.
The web stretches far and can offer a lot of opportunity. Well, we definitely appreciate the insight that you've provided today. The conversation really, I think, is eye-opening for a lot of people. And thank you again, because as we mentioned, this week is all about celebrating nurses, appreciating what they do. And what we've talked about today really is where it starts. So sharing those final messages with students who want to be a nurse, who want to get into this work, this is the conversation that could be for you if you're thinking about stepping into this role. If you are watching, if you have thought about becoming a nurse or wondering if you are capable, then this is what that path could really look like. We do want to thank Jennifer so much for her time and for what she does by helping build that next generation of nurses. And we thank you on behalf of our entire team for joining us. This is Voices of Vital Care.